Many patients come to me saying, "Doctor, I've hated my nose since childhood. Can you do something for that?" If you are hiding your nose in the photographs, then this video is for you. Let's talk about rhinoplasty. Rhinoplasty is a surgical procedure that helps to improve the shape and size of the nose. In rhinoplasty, we improve the bridge, tip and size of the nose. We try to create the symmetry in the nose and also improve the breathing issues. Most common reasons where patients come to us for rhinoplasty is mainly because of if they have a hump on the nose, if the tip is droopy, if they have breathing issues because the septum is gone towards one side, and also if they feel their nose is very big or very small. Most of the patients chooses rhinoplasty for such concerns. Sometimes we do rhinoplasty for cosmetic concerns, sometimes we do for functional reasons. Sometimes we do for both cosmetic and functional reasons. So let's talk about treatment options available in the rhinoplasty. In rhinoplasty, there are two types of rhinoplasty. One is closed rhinoplasty, one is open rhinoplasty. In closed rhinoplasty, we do not make any incision or cut over the nose. In open rhinoplasty, we make a small cut over the root of the nose, which will not cause scarring in the future. We choose this type of rhinoplasty based on patient to patient basis. Many patients requires closed, some patients requires open rhinoplasty. In selected cases, we combine septoplasty along with rhinoplasty for improved breathing. There are varieties of rhinoplasty surgeries and each surgery is chosen on patient to patient basis. So technique of rhinoplasty depends on the anatomy of the nose, not just the trending. Now let's talk about how the rhinoplasty surgery is done. Rhinoplasty surgery is done under general anesthesia. That means the patient is put to sleep during the surgery. So patient will not remember anything that happens during the surgery. Usually the surgery takes around 3 to 4 hours for us to do the surgery. In rhinoplasty surgery, we improve the shape of the bone and cartilages to get the symmetry and the facial harmony so that you look much better. In rhinoplasty, we always ask our patients not to compare with other noses, rather see how much it has improved from what they were and what they will become. So precision is very important in rhinoplasty surgeries. We need to give a lot of time and attention to improve the details on the nose. So then let's talk about how the recovery of rhinoplasty will be. Usually after the surgery, patient will stay in the hospital for a couple of days for the recovery to happen. Mild bruising and swelling can be there up to 1 week after the surgery, but eventually it keeps on improving over a period of time. First 2 days after rhinoplasty, we will be doing some splintings, that is called as internal splinting, where we'll pack your nose and usually patient has to breathe through the mouth. Once that phase is done, we put a splint outside the nose which will be there for a week. So if you are planning for a rhinoplasty, we always advise you to take a week or 10 days leave from the work as you need some recovery from the rhinoplasty part. So most of the patients can go back to work in 7 to 10 days, but the final results of rhinoplasty sets in around 3 to 6 months after the surgery. The possible risk associated with rhinoplasty is most commonly sometimes bleeding, sometimes infection, but fortunately this can be treated very easily. Possible risk of the surgery would be some asymmetry, some swelling and some bruises, which usually settles over a period of time. Rhinoplasty results are like a wine of bottle where it keeps improving over a period of days or months. So usually after a year, the rhinoplasty results will be much better than what is it after the 6 months. When rhinoplasty is done by a qualified plastic surgeon, it gives the best results to the patients. Now coming to the cost factor, which is very important. When you plan a surgery, you need to have an idea of a budget as well. The cost factor varies from person to person because of the complexity of the surgery, type of anesthesia, type of hospital where the surgery is being done, and also the experience of the surgeon as well. Don't just go with the lesser cost or budget friendly cost. Always ask for the credential of the doctors, experience of the doctors, so that you can get the best results. Rhinoplasty is a precision surgery. So if you're planning for a rhinoplasty, get a proper facial analysis before getting the surgery done. For more such videos on cosmetic surgery, do follow, like and subscribe our channel.